We can hear you loud and clear.
Good afternoon.
Okay, I can hear you now, Matt.
I'd like to
Thanks.
welcome all of you to this COVID update for the town of Plymouth. It is Wednesday, December 16th, live, coming to you at 12 noon. This is update number 78, coming to you live from PAC TV studios. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. I'd like to welcome today's guests and panels. We're joined each week by Kenneth Tavares. He is chair of the Plymouth Select Board. Also by Matthew Muratore. He is Plymouth State Representative. And our panel includes Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Christopher Campbell, Stephen Cole, and Father John Culloty. And at this time, we're going to begin with the chair of the Plymouth Select Board, Kenneth Tavares. Welcome, Ken.
Thank you, Steve, and good afternoon to everyone. I certainly think there's a little bit of enthusiasm in the community today. The talk of snow, it almost just entitles us to take a few hours off, which everyone should. Pour your favorite drink, look out the window, light the fireplace, enjoy. Also, the fact that we're getting, hoping we're going to hear more from Dr. Triffletti with the vaccine arriving, that's also a great early, I'll call it a Christmas present. As an update, last night, I'm very pleased to announce that the Board of Selectmen supported the request from the Board of Health to hire a part-time community public health nurse. This is going to certainly hopefully streamline the work in the office, and we're looking forward to hiring someone to help Karen and her staff out. Also, the Board of Health has placed this position in the budget to be funded at town meeting this spring, which I can tell you without any doubt in my mind, I actively am going to support this. The time has arrived, the time is here, we need the help, and this is the way to do it. With that, Steve, I pass the baton back to you.
Thank you, Kenneth Tavares. He is chair of the Select Board for the town of Plymouth. And yes, town meeting is coming fast upon us, first Saturday in April, this coming spring. At this time, we're going to go to our medical segment. We're going to begin with Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Good afternoon, Steve, and thanks again for having me. I just want to make sure you can hear me well. I'm having a little trouble hearing you, Steve.
We can hear you. Go ahead. You're coming in.
Okay, thank you. So I just want to start by, let's take a pause and just celebrate this moment that, we have come so far with our biotechnology that, within a year, we're able to manufacture vaccines. Those shots are getting into people's arms this week. In the United States, it's just an incredible, achievement for medicine and all the logistics involved. So I think we just should pause for a moment and think about what an important moment this is really in history, that we can respond so quickly to a deadly and lethal pandemic virus. It's just a, unbelievable accomplishment, achievement for our biomedical community. I'm, very, very grateful for all the hard work that's gone into this. And, this is going to pay off. This is going to save, millions of lives in the United States, and it's going to save, many, many more millions of lives worldwide. It's just an incredible achievement. So, it's very, very exciting. And of course, everybody knows since the last time I was on the broadcast 2 weeks ago, United Kingdom started using the Pfizer vaccine, and now you're starting to see, people here in the United States get them as well. And it's just, couldn't be more welcome. Given what we're facing. I get a lot of questions, from patients all the time about different things. And so people now are saying, when will I be giving them the vaccine? And, as you probably all know, this Pfizer vaccine has what's called a cold chain requirement. And it needs to be stored at minus 95 degrees. And there's very, limited numbers of places that have that type of freezer that can achieve those low temperatures. And so as a result, the state of Massachusetts in their plan with the Pfizer vaccine has really been distributing this to hospitals, and also early, they've put together a 3-phase approach to using the vaccines and how they're going to immunize everyone. So in the first phase, it's really going to be hospitals and nursing homes in that first phase. And so while hospitals will be receiving these shipments from Pfizer, Walgreens and CVS will be receiving shipments from Pfizer and distributing those to the nursing homes. So those will be the first sort of 2 ports of entry for the vaccines. And, I don't think all the details have really been revealed publicly yet about, how, as we get more vaccines from more manufacturers, how all the vaccines will ultimately be distributed. But as I'm sure you all know, with once we get through the phase 1, which is the healthcare workers, nursing homes, other essential workers, then you'll be going on to phase 2, which will be people over the age of 65, people with high-risk medical conditions will be in phase 2. They believe they'll be able to complete phase 1 by approximately, February or so. Then they would start with that second group around February through April. And then the third phase would be basically, April through June, where there would be availability for the rest of the healthy public to get their vaccine. So, they're optimistic that in the state of Massachusetts that we could, by the end of June, get everyone vaccinated. And I just think that's, again, incredible achievement that we're looking at. And it's very gratifying just to see that these are, happening as we speak. People are getting the shots, getting started. The state did say that I might eventually get it in my private office, but I don't anticipate getting that anytime soon. I think it'll be several months before I actually will have the availability in my office. But so I'm trying to curb some of the enthusiasm, because a lot of people are anxious just to get in line and get the shot. Not everybody. Interestingly, looking at the surveys now in the media, you may have seen they're now quoting higher percentages of people who are interested in taking the vaccine. At sometimes during the past year, it was as low as 50%. Now they're quoting up to 71% of people are now interested in taking the vaccine nationwide. And of course, here in Massachusetts, we're very fortunate. We're probably have higher percentages than the national averages. So I'm very excited. When they talk about the herd immunity, we need to get to 70, 80%. They're saying now people vaccinated. I think we'll easily achieve that in our communities here, in most of our communities. In some communities, it will probably be more difficult, but as they've talked a lot about some of the socioeconomic racial disparities in terms of willingness to take the vaccine. But, I do feel that in Massachusetts, we're going to continue to do very, very well. I do want to say that, before I went to medical school, I was a pharmacy major and I practiced as a pharmacist in a hospital for a few years before I went on to medical school. And, studying about the drug development process and, the government regulation and how we've developed our Food and Drug Administration over 100 years of dedication we've had to, ensuring that drugs were safe and effective. I feel like we have a great process. I'm not concerned personally or professionally about any compromise to that at all. And I think, you could even see different leaks in the media about when there was political pressure on the FDA chief to, try to move this along faster. I think he just, let it move at the pace that they could deliver. But I feel like they did not rush this vaccine. So I am completely supportive and comfortable about the data that's been released thus far about the effectiveness, knowing that the Pfizer and Moderna, have a 95% effectiveness is just incredible. And what is it effective to do? It's effective to reduce the number of people that get symptoms from the virus. That's what they told us with Pfizer. Less people get sick and less people get hospitalized. Virtually eliminates hospitalizations when people take the vaccine. One really interesting news item that came out this morning was that with the Moderna vaccine, which is in the process of going through the emergency use authorization approval process as we speak. And hopefully this week that will also be approved like Pfizer was last week. They found they were doing nasal swabs. Pfizer did the same thing after they gave the first shot. And they are finding that not only do people not get sick if they take the vaccine, and not only do people not get hospitalized, but they also are finding people were not getting infected when they checked the nasal swabs after a few weeks from the first shot. So that's very exciting news, because we didn't have that news from Pfizer company on their vaccine, but it's just more evidence, I think, of how effective these vaccines will be. Very exciting to know that it's probably going to also prevent infection, not just prevent you from getting sick or hospitalized. Very important. I think it's important to point out a lot of people worry about side effects, and the side effects are mild. Small percentage of people get them like they would with any vaccine. People might get a mild fever. Occasionally, people might get a high fever, muscle aches, but no real serious complications. The Pfizer release in Britain, you may have heard of, they did have a few people that had severe allergic reactions. And so now they do have a caution that if you're somebody who carries around an EpiPen because you've had severe allergic reaction, anaphylaxis with drugs or with other allergies to foods or things like that, they may not want you to take the vaccine at this point because of that. And we need more data on the other vaccines in development to find out if they'll be safe for people with severe allergies. But that seems to be the only caution at this point. So I think the side effects are mild, very safe. One of the things I'm quite intrigued about, and I've mentioned this on a few other broadcasts, is how many other institutions will perhaps require vaccination. So I went online this morning. I found the World Health Organization is thinking about they're working on developing a what's called a vaccine passport that would be sort of proof of vaccination. I saw at least one airline for international flight, Qantas from Australia, where it looks like they're going to require people to be vaccinated when they fly internationally as the vaccine becomes more available. So that's another example. Israel, in their country, is also developing the ability to track and give people vaccine passports, and I think will be requiring that to use certain types of things within their society. So while we may not come that far in terms of some mandatory things, certainly with our government, I think, again, I would encourage different institutions to think about ways that they might come to eventually, once we have adequate supply, require vaccine. I would love to see that, because I do think this is such an important problem. This pandemic is so serious. So many lives have been lost. So many more lives will still be lost until we get it under control. I think it's essential that we really, take advantage of all these tools that we have to, prevent infection, including, the vaccine. The last thing I want to say about vaccines is that one survey indicated that the most trusted source for people to listen to when it comes to taking a recommendation to take a vaccine actually is doctors, it's physicians. And they said that about 80% of people would trust the opinion of their doctor. So I think if you know anyone personally, if it's a family member, a friend, an employee, anybody that that has reluctance to take the vaccine, I would just encourage them to talk with their personal doctor about the safety and effectiveness of it. I think, a lot of other sources that are more at a distance may not have as much of an impact, but I do believe that we can individually with our patients really encourage people. A lot of people want to be first in line. Some of the surveys show maybe 30-40% say yes, I'll be first in line. I happen to be one of them. And there's a lot of people that want to stand on the sidelines probably for a few weeks or a few months and see how this progresses. And then when you add those two groups together, you get that 70% or so of people that will take it. But I think have people talk to their doctors if they're reluctant about the vaccine, because that's probably the most trusted source for them. Now, getting on to testing, my brother Steve and I were having some back and forth communication this week about how hard it is to get tested. And I actually called in the Plymouth community and I checked online. So there's a CVS in Plymouth, for instance, that will do testing. And the only issue there is that the turnaround time that they report online is maybe 3 to 4 days. So that's not ideal. In I think a lot of places right now, because of the surge of the pandemic and the number of tests that are being done, it's hard for all these companies to keep up with the volume. When I checked with the Beth Israel Deaconess Plymouth Hospital, they told me that you could get an appointment within about 24 hours and you could get your results within 48 hours. And I think that's still excellent service there in your community. So if anybody does need to get tested, you can just go online and look at BID Plymouth and you can make an appointment. They do testing Monday through Friday, I think is their schedule. They don't do weekends. But that's an excellent resource if you need it. On testing, some really exciting things in the news this morning. They reported that very soon in your local stores, about a month from now, you will be able to buy, a consumer can buy over the counter a testing kit, which will be, they said, 91% accurate. That's pretty good. The hospital labs are probably, not 97 to 100% effective. So accurate. So, a little bit better in a hospital lab, but I think that's a very good product that will be over the counter for about $30. The company plans to be able to produce about 3 million units per month. So it won't be enough. I'm sure that it'll be relatively scarce when you think we have over 300 million people in the United States. But it's still very exciting to know that people eventually could buy their own test and test themselves at home, much like people do for urinary tract infections and other things. And also, I'm noticing that I'm also receiving some marketing from lab companies showing that I could also order office-based testing. Again, not as accurate as the hospital-based testing, more in line with what I was quoting there for buying over the counter, but that I will be able to offer some testing. Those are antigen tests in my office where you could get a quick turnaround, like 15 minutes, and get a really quick result. So I think lots of good things happening on the testing front. So good things on vaccines, good things on testing. The last thing I want to talk to is just what's going on with the infections. And they had Dr. Giroir, who is an admiral and part of the Department of Health and Human Services. I listened to him on CNN this morning, and he was pretty somber, really, about the numbers of people getting infected nationwide, the number of hospitalizations, the number of deaths that we're seeing. And, he was describing as very serious, dangerous crisis. I think we have to think of it that way. We probably have another 6 months or more until we can get to that herd immunity. We can really control things with vaccines. So in the meantime, we really have to buckle down on all these other things that we can do to prevent infection. I was just talking with a close friend of mine from Marshfield this morning, telling me how she took an invitation for Thanksgiving to go over to her friends for Thanksgiving meal. And it turned out that the hosts had, unknowns to them, they had were infected with COVID, and they ultimately got symptomatic, not very sick. But then, my friend who was exposed to them during Thanksgiving, had to quarantine for 14 days. Luckily, she did not get sick. But I think it just reinforces, how risky it is. And I think sharing meals, is probably among the most risky things that you can do, because you take off masks. And then if you were to go and look at a YouTube video about how this virus spreads when you're touching foods and plates and sharing things, I mean, it's just incredible how infectious this virus is if you do those things. So I think for the holidays, again, I appreciate Governor Baker's leadership on this. And he says, stay home with your immediate family. Don't invite other people over. Don't have parties, all these things. I was incredulous this morning when they were talking about Secretary of State Mike Pompeo apparently invited over 900 people to a holiday party. And I guess most of the people declined the invitation. They were smart. And so it's not clear how many people actually went. But, you don't want to go to holiday parties. You just want to, stay with your immediate families. We have to continue to do that so that, we don't have these large expanded bubbles that foster the spread of the virus. So, I think you'll hear from others about what's happening with infections. Maybe in the state of Massachusetts, we're plateauing a little bit, but the hospitalization numbers keep climbing. We're only about half as bad as we were in the spring. But as you know, and I'll remind people, hospitalizations, they lag behind the infection. So as the infection rate goes up, the hospitalization rates lag behind a few weeks. Same with deaths. Deaths lag several more weeks behind hospitalization. So I don't think we know exactly how bad things will get in Massachusetts. In other parts of the country, I think they're struggling much more with hospital capacity issues. We're still doing very well here in Massachusetts. We've got adequate hospital capacity for beds, whether it's ICU beds or regular beds. So things are stable here now, but we still have to do all these things that we've been talking about. So, we're recommending, don't travel, spend time with your immediate household. If you do travel, you may want to get tested, of course, 1 to 3 days before you leave. After you arrive at your destination, you may want to get tested 3 to 5 days after arriving as, extra precautions for trying to avoid the spread. And, you must really do universal masking. You must wear masks when you're indoors with people who are not part of your immediate household. I can't emphasize this enough really right now. So that's all I have to say, Steve, for now. I'm happy to take questions later. And thank you for having me on again today.
Thank you. And that's Dr. Philip Trifletti. He is an attending primary care physician at Beth Israel Deaconess, and he'll be available to answer questions. You can send them to PlymouthInfo@pactv.org. And what he said about trusting local sources is what we've been hearing nationally from many of the medical leaders, that in order to have the vaccine be successful, many people be looking to people locally. And so that's what we've been doing here with our weekly updates, is providing experts and local officials to provide Plymouth's response. And at this time, that leads us to our own chair of the Plymouth Board of Health, Dr. Barry Potvin. Welcome, Barry.
Oh, thank you, Steve. I'll try to keep my remarks as brief as I can, but I wanted to cover 3 different things. One of them is just a follow-up on what Dr. Triffletti was talking about. I want to reassure people about vaccine safety. So a lot of people were concerned that the vaccines were produced so quickly in comparison to what's happened in the past. And that's really because of the way these vaccines are being produced. The previous record for vaccine production was the Mumps Vaccine back in the late 60s, early 70s. That took about 4 years before it was able to be distributed. The reason for the length of time involved in that was that they really had to grow the viruses that cause the mumps in chicken embryos within eggs. That's a very time-consuming, slow process, and they had to produce tremendous amounts of the viruses in order to be able to manufacture the vaccines for that. In this particular case, at least in the case of the 2 vaccines that are approved or about to be, they simply used the sequence of the genome of the virus, which was published fairly quickly by the Chinese scientists. And they were able to extract from that, using a computer analysis, the gene that encodes the spike protein on the surface of the virus. Once they had that, it's very fast to make tremendous amounts of that particular sequence of messenger RNA. They then just package it into these little submicroscopic lipid sort of particles so they could transport it into the cells. So yes, there was a lot of money thrown into it. Yes, there was also an awful lot of very hardworking scientists that worked night and day on this to try to make it happen quickly. But at least a lot of the reason for this is there was no need to grow virus particles in anything. So the virus, it does not exist inside of the new vaccines. The only thing in there is some messenger RNA molecules that have actually been slightly altered that will encode the protein on the surface of the virus particles. You cannot get COVID from the vaccine. It's just not possible. There is no live virus in there. There is no attenuated virus in there. It's nothing like the Salk and the Sabin vaccines. So I thought it was important to let everybody know that so that you can be reassured when you do get the vaccine that it's generally going to be quite safe with minimal sort of issues in terms of side effects. Next thing I wanted to mention to everybody was a follow-up on the Christmas safety sort of guidelines. I was watching the governor's news conference yesterday, which I usually do, and he had a little poster off to the side. On the heading of the poster, it said, COVID never misses a party. So you don't know it's there. It wasn't invited. But remember that about half the people who are infected with this coronavirus actually show no symptoms whatever. And they don't even half the time know that they're infected. And it's a major source of infection when you get together with large numbers of people. As Dr. Triffletti said, Dr. Baker said, it really is the safest thing to do to try to restrict your gatherings for the Christmas holidays or other holidays at the end of December, just to your own household members. So if possible, not even family who don't live with you. And that's probably the safest thing to do. It's going to be a lot to ask. He's also asking people not to travel. And they did a survey and they found out that 70% of people are not going to travel for Christmas, but 30% still plan to. So you have to keep in mind the fact that this is just 1 year. We're not going to probably be going through anything like this a year from now for the holidays coming up. And keeping in mind what Ken Tavares has on his shirt today, I'm pretty confident that Plymouth 400 is going to be a go for this coming year. Certainly things should be getting much better by the summer and the fall and winter of next year, primarily because of the virus. But in the meantime, we have to watch out and be very careful to wear masks and practice other safe procedures. What happened at Thanksgiving was kind of scary. Before the holidays, there was about 2,500 cases per day being diagnosed. But shortly after, about 13 days, which is the time frame you'd expect, it went up to 4,800 cases per day. This was a direct result, for almost certainly, at least partly, of the Thanksgiving celebrations that went on. Hospitalizations went up by something like 93% in the 3 weeks after Thanksgiving. ICU admissions went up by 73% or so, and deaths went up by 84%. I don't know what else anybody has to hear beyond that to realize that this is a very dangerous time, and we have to be very careful, and we have to protect not only ourselves and our family members, but the other members of our community. And just remember also that as the hospitalization rate goes up, it's very closely watched. And if it gets anywhere near capacity, it's entirely possible that more strict restrictions will be put in place to try to get a control over it. That's going to hurt our economy. We don't want that to happen if we possibly can. So just all we're asking you to do, in addition to wearing masks and keeping your physical distance, is just please, please, please be careful. Just suck it up for 1 more year. It's not a huge ask. And if you do this and we all cooperate, things won't be nearly as bad and we'll get through this much more quickly. Last things I wanted to mention to you was obviously some statistics. I know that Matt likes to do this. He just disappeared from the screen. Oh, there he is. Hi, Matt. I saw your hat also. Not today, COVID. Well, COVID is around today, Matt. I'm sorry, but well, hopefully it'll be going away sometime soon.
Not in my house, though.
We're still in the second surge. Every time you turn around, you hear about somebody else that's gotten infected. I just found out my next door neighbor was a few days ago. Fortunately, I've had no direct contact with the neighbors. But if you stop to think about what's going on, yesterday there were 3,720 new cases in Massachusetts. That's now a total of 286,866 people in Massachusetts that have gotten this. Yesterday, there were 35 new cases in Plymouth. There was 1,834 hospitalizations in Massachusetts yesterday, 371 in the ICU. Don't know those numbers for the Plymouth community yet, but there were deaths. We're now up to 99 deaths here in Plymouth. And in Massachusetts, 11,190 deaths have occurred since the start of all this in Massachusetts. Just to put this in perspective, if you look at the US numbers, it's kind of shocking. 16,309,000 19 or 17,872 cases in the United States, the worst in the world. There is no other country that comes close to it. There are just 7 states, if you look at colored maps, that are as bad as Massachusetts right now for the past 7 days. If you think about all these deaths in the US, there's 300,032 of them that have been recorded so far. Just think about it for a second. In all of World War II, there were 411,800 military deaths from US service people. And of those, 291,557 died in combat. We have exceeded the number of people that died in combat who went over to fight in World War II. We are now at more than 300,000. That's just shocking. Why this is happening, there's a lot of different reasons for it. If we had fought much harder and we'd been much more careful, maybe this wouldn't have happened. But we are where we are. We've got to watch the hospital capacity, and everyone has to be really careful. Please wear masks. Remember that the vaccine production is limited. It may take longer than they think to get enough vaccine produced and distributed. There will be vaccination programs. The nursing homes and congregate living facilities will be serviced by CVS and Walgreens. They're hiring a lot of people to help with vaccinations. After that, we'll have to think about how we're going to get everybody who wants to be vaccinated in the Plymouth area vaccinated as efficiently and quickly as we possibly can. Until then, everyone, please stay safe, stay healthy, and I'll be happy to answer questions later on. Thank you, Steve.
Thank you, Dr. Barry Potvin. He is chair of the Plymouth Board of Health. This time we're going to go to Dr. Christopher Campbell. He is the superintendent for Plymouth Public Schools. Welcome, Chris.
Thank you. Hey, Steve. Good afternoon. Thanks again for having me. I have a lot of information to share with the viewers, but I'll try to be as succinct as I can. First, just a general COVID update regarding the schools. So post-Thanksgiving break, our district has experienced its highest number of weekly confirmed cases and quarantine individuals, both staff and students. Last week, the number of students with confirmed COVID diagnosis due to exposure outside of school was 9. None due to exposure in school. The number of students that we had quarantined as of last week was 107. Regarding staff, the number of staff with confirmed COVID cases due to exposure outside of school was 5. Again, 0 confirmed due to in-school exposure. And the number of staff that were quarantined as of last week was 17. So the total, we've been keeping track, as you know, since we opened school. We have our COVID dashboard, which is updated every Friday by 3 p.m. So the positive cases to date, as of last Friday, we had 53 students since we started keeping our data at the beginning of the year, and 20 staff that have confirmed positive cases. And the average number of quarantines per week, when we look at that 2-week quarantine, we average about 58 students over the course of the year so far, and 9 staff per week. We've also experienced many new cases this week, but what we're seeing largely is household transmission. The situation in our schools has not changed since I last gave an update to your program. We continue to demonstrate no confirmed cases, as I said, which have resulted from exposure within our schools. All our confirmed cases are due to external exposure. What the town is experiencing this time is an increase of confirmed cases from residents outside of our school community. As a school department, we're experiencing an increase in cases among households. We continue to proactively address and manage various scenarios around COVID-19 as we have since the beginning of the year. We continue to consult on a case-by-case basis with the Department of Public Health epidemiologists. We utilize DPH and our Department of Ed guidance, working hand in hand on a daily basis with our public health director and school physician. And we're consistently in communication with Dr. Potvin. In fact, we have a meeting this afternoon. So our total collective collaboration continues to be a significant support to our district team as we safely manage the situation and the occurrences around COVID-19. So our staff, our students, I believe that the entire team has done a remarkable job in practicing our primary prevention strategies and measures in schools. And it's critically important, as Dr. Potvin just said, that we also continue to practice these important prevention strategies, outside of school. As has already been referenced by both Dr. Triffletti and Dr. Potvin, Governor Baker announced the rollout of vaccines, and teachers have been prioritized in phase 2. So according to this information, vaccines will be available to educators between February and April, and it's very encouraging to hear that our educators will be high up on that list, so we look forward to that. It comes as no surprise that as a district, we are very concerned about the impact this pandemic has had on our students. The mental health issues our students are facing across the nation, really, but here in Massachusetts and Plymouth have been great. And as a state, as we know, we've seen an increase in ER visits for mental health reasons, and we need to do everything in our power to make sure that our students are connected to adults. So the Department of Education previously asked for 3 models of instruction, and it's broken down in our entry plan, which is on our website. And at that time, the department did not take a stand on what's called synchronous learning or live instruction. But medical experts are saying that we have a real medical crisis on our hands when it comes to our students without having a daily connection with school. And I support that concern 100%. At a meeting with the Board of Elementary and Secondary Education just yesterday, the commissioner recommended to the board an amendment to student learning time regulations on an emergency basis. So I just want to explain that for the viewers, what that is, and give some background. So under Massachusetts student learning time regulations, school committees are required to schedule a school year that includes at least 185 days each school year, and are required to operate the schools for at least 180 days each school year, with the exception of this year. So in June, the Board of Education adopted amendments to these regulations on an emergency basis, and in September, the board voted to adopt an adoption of those amendments, and a final adoption. And that was when we came back and had our teachers had days to transition to school, and so those regulations were modified. So when we began this process of reopening schools, the commissioner asked districts to create plans for 3 models: remote, hybrid, and in-person. And consistent with these regulations, commissioners asked districts to prioritize safe in-person instruction whenever possible. So for remote or hybrid models, these regulations did not set any requirements on the amount of instruction that should be synchronous or live as compared to asynchronous, which is done independently of a teacher. So over the fall, as I've said, we've seen a distressing increase in mental health challenges across the Commonwealth in Plymouth. And based on discussions at the department level with pediatric medical community, the commissioner has expressed concerns. In addition, as many people know, there was a report in October by the CDC that noted the increase in the proportion of child ER visits due to mental health reasons, anywhere from 24 to 31% increase, depending on the age of the child. So we know that one way to prevent isolation and disconnection for many students that are feeling these is to have frequent connections and interactions with our teachers and peers. And for that reason, the Department of Education undertook to learn more about the extent to which districts are providing in-person instruction, both synchronously and asynchronously. So back in November, we were asked to gather information or provide information to the state related to the number of hours that our students are spending learning synchronously or live with their teachers. We were asked to provide that information over the course of 10 days, the average for a 10-day period. So no surprise to anyone, I believe that the data show that both remote and hybrid models, there is great variability across the Commonwealth in the amount of live instruction that districts are providing to students. Additionally, the data is showing that districts have been implementing the hybrid model in various ways. So for example, hybrid models may include 2 days of in-person learning and 3 days of remote learning each week, or 1 week on, 1 week off. And the data is showing that school days every 2 weeks are, in some cases, are completely asynchronous, meaning that districts may not be providing students with live instruction on a day-to-day basis. Here in Plymouth, we have 2 days in most cases that are considered asynchronous for students. So given everything that I just highlighted, the commissioner has recommended to the board to adopt amendments to the minimum amount of time live instruction should be taking place in all models across the Commonwealth. So this recommendation was approved yesterday and will go into effect by January 19th. So to summarize the amendments, so effective in January 19th, Districts and schools operating in a hybrid model must provide at least 35 hours of live instruction over a 10-day period. And again, live instruction could be a combination of in-person when our students are there, or remote instruction where the students are logging in a live capacity like we are right now. Students must also have an opportunity to interact with each school day with teachers. And that's something that's critically important. And this all goes into effect January 19th. Also, districts and schools operating in a remote learning model must have at least 40 hours of synchronous instruction over 10 days. So if we were in the situation where we went remote, we would have to have at least 40 hours of synchronous instruction. So these, as I said, the board has adopted these regulations on an emergency basis, and there'll be public comment period, and the final adoption of these regulations will go in February, but they do go in effect, the emergency operations, January 19th. So we've been working very collaboratively with our Teachers Association to adjust our hybrid model in a manner that will meet the requirements of this amendment and best serve our students, families, and teachers. And we'll be discussing this at our next school committee meeting. We'll also be discussing something that we've been very concerned about is how this pandemic has impacted our students, both not only emotionally, but academically. And we'll be doing a presentation to the school committee on December 21st. So more information to come on that. We'll be looking at a lot of data points and sharing that with the community. And at this point, I will give my final words at the end and take any questions that the community may have. Thank you, Steve.
Thank you, Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools. He'll be here to answer your questions. Send them to plymouthinfo@pactv.org. And that completes our education segment. We're going to move on to our business segment, and we welcome back Stephen Cole. He is Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hey folks, I see me pop up on the screen here, so I think it's my turn to talk, but Steve,
It
you cut
sure
out there
is.
at the end, so I'm not
Right.
sure if, yeah, there you are. I hear you now, I can see you. So I'll dive right in. I know there's a lot of information to share still, so just jumping right in with the unemployment numbers. Last time I was here during the week of 11/14, we were experiencing a 6.2% unemployment. I'm glad to say that yet again, we continue our trend in the right
Can you hear me,
direction
Donna?
since April at 4.1%. 4.1% unemployment. However, that still represents 1,300 people in our community who are looking for a job and do not have one. Some of the large companies, we've seen some forecasts and some pleas coming up from folks like Warren Buffett. Without congressional support, we were going to experience some difficult times in our small business community. I know some of the large companies have been able to keep themselves afloat largely by selling bonds and stocks. In fact, $2.4 trillion in bonds have been sold to keep these larger companies afloat. But frankly, here in Plymouth, we take care of our own. And that's why I'm glad to say that we have a couple of small business assistance programs that's being run by the town of Plymouth with some of our support. Since the CARES Act has gone into effect, the town has received a total of $796,000. They are offering right now grants up to $20,000. These are grants, folks. This is completely free money. This isn't PPP. This is not speculative. This is free money offered by the town of Plymouth. It's a 6-page application. I can tell you Peggy Whelan and Lee Hartman, who are running the program, are very responsive. And I have here, forgive me for conferring with my notes, but I have here just a couple of bullet points I want folks at home who are either running a small business, working for a small business, or know someone who owns a small business. I want you to pay attention to this because there are many, many more people in this community who are qualified to receive this free money than have actually taken advantage of so far. You must be a for-profit business, licensed and located in the town of Plymouth, have fewer than 20 employees, be in an industry that has been affected by COVID-19, which is frankly almost all of them, demonstrate the incurred income loss because of COVID-19, demonstrate the need for working capital for eligible expenses, and frankly, the owner or one of the employees must also be considered what's called moderate or low income. Frankly, I want to put in perspective here, moderate or low income for our area means making about $65,000 a year. So there are many more people who qualify for this than actually realize they qualify. If it's the application that is an onerous or a barrier to entry for you, I have copies of the application in my office. I'm very glad to assist you with it. So if you are hearing my voice and you think you might be eligible for a free $20,000 grant from the town of Plymouth, please reach out to the foundation. I'll be very glad to assist you with your application. Lastly, Steve, I want to make folks at home aware that there is a new initiative being presented by the state of Massachusetts called the Mass Local Rapid Recovery. The foundation, along with the town of Plymouth and the Chamber of Commerce, have submitted a application so that we could hire through the state's funding sources. We can hire a small business development liaison whose purpose will be to communicate the concerns expressed by small local businesses within the town's 5 village centers and report on mitigating policy objectives to myself, the town, and the chamber. We expect that if we're funded, this person will be aggressively creating marketing strategies to assist small businesses to return to their pre-COVID activity levels. We expect that this person will also identify and report on public and private capital investment needs to support Plymouth small local businesses, because frankly, it's not enough that we build back the way we were. We got to build back better now, remember? And then lastly, we expect that this person will examine regional and national COVID best practices that can be used to help develop future resiliency strategies for our small businesses. So I'll pause there for now, Steve. I hope folks at home understand that there's a lot of activity out there. We do have some funding mechanisms in place to assist small businesses. And if you are thinking about starting a business, I know now doesn't necessarily seem like the time, but now is absolutely the time to start to think about the type of job you want to have, the type of job you want to create for your friends and family. Because as I said at the start of this, there are 1,300 people in our community who are looking for a job, and we're going to rely on each other, I think, to help create some of these jobs. Thanks, Steve. Appreciate the opportunity. Great to see you all again.
Thank you, Stephen Cole. He's the Executive Director of Plymouth Regional Economic Development Foundation. This time, we now welcome back Father John Culloty from St. Mary's Church here in Plymouth. Father John, the holidays are a time for great joy for many, for some also a time for sadness and for stress. What can you say to us today to help us as we try to navigate the additional challenges of the pandemic? And if you
Yes, I think, Steve, you're right on. Am I okay?
Yes, we can hear you. Yes.
Oh, great. As you mentioned, yeah, holidays are times for a lot of happy memories for people, but also can be very challenging for a lot of people. Can be a very depressive time if people have lost family members or friends or are alienated in some different ways. I think the majority of the houses of worship have tried to be very respectful of the guidelines that have come out from public health. For example, at St. Mary's, the church seats almost 700 people with capacity. We limit it to 85 people for each service. And people have been very receptive to wearing masks at all times, keeping social distance, not lingering before or after services to chat with other people. But of course, the wild card is Christmas. Normally, we ask people to sign up to reserve a spot so we know how many people to anticipate. And we have to really shut off those numbers if they exceed our capacity. But Christmas, people might come out of the woodwork, as we say. And we really hate to turn anybody away, but I think it's better to be safe than sorry. So if that's a necessity, that will have to be enforced. Again, this time of the year, we get many requests for help, both at Thanksgiving and Christmas, for both food help and also for families with children. Normally, we would have those things available person to person. This year, we've gone to gift cards for the most part because, again, we feel that's the safest way to help people get navigate their way through these holiday seasons. The sad part about that, I think, is the fact that sometimes when people come in asking for help, engage them in conversation, you learn that their problems sometimes are deeper than they seem on the surface, and you're able to connect them or help them in some other way. You lose some of that by this more impersonal way of helping people at this particular season, but that's the challenge that we have at the present moment. As some of you know, we serve meals every Saturday afternoon. We call it Matthew's Kitchen. Anybody can come and sit down and have a meal. Again, we haven't been able to do that since the pandemic. We do carry out meals now. People come to the hall and they take the food with them, which again is unfortunate that these people can't have any social interaction that they normally would be able to have. I was mentioning to Ken before we got on that one thing for a lot of older people coming to the houses of worship is a really almost a social time as well as a religious time. And I think a lot of them really missed that interaction, but thank goodness for live streaming. We're able to at least keep in contact with people in that way. We did have a team of priests that were trained to work with people in hospitals and nursing homes. They were given all this PPP equipment. They were isolated because it's very hard, very challenging, both for families and for the individual to die alone, as it were, and to have some comfort. So these PPP teams were very successful. They ministered to many, many people. No one became sick. They disbanded it because the virus seemed to be a bit more under control, but it's going to be resurrected again. I was called to a nursing home recently by a family. Their aunt was in palliative care. I wasn't allowed to enter because I needed to have a negative COVID test before I could enter. And again, with the time frame of waiting for the result to come back, it would have probably been impossible. So we hope this team will be resurrected and able to at least reach out to families and individuals during a very critical time. Same issue, I think, comes up with funerals. Again, people want to mark another person's passing. It's very hard to limit that scope. But again, people, I must say, have been very, very cooperative in understanding that it's better to make the sacrifice this year in the hopes that we can have a much better year in the months that lie ahead. So I think that's basically what's happening. I think, fortunately, we have not had any outbreaks, as far as I know, in houses of worship that have been conducting services. But again, I think it's due to the fact that people have been very observant of the guidelines that we've been given at the present time.
Thank you. And that's Father John Culloty from St. Mary's Church. He'll be here with our panel for their closing thoughts. We're now going to go to Plymouth State Representative Matthew Muratore. Matt, last week you shared with us your health. How are you and your family doing this week?
Well, as was pointed out by Dr. Potvin, I have my hat on today, and it's not about not today corona in the world, but it's in my house, not in my house. So it's completely gone. All our kids tested negative, thank God. I came out of quarantine over the weekend, and Kristen will be out by Friday. But everyone's healthy, no symptoms, and thank God for that. And it's funny when you start to listen to some of these statistics. More than half of those folks that are testing positive are asymptomatic, which was unlike that back in the spring. So it's interesting how it's going. It's so good to hear Dr. Triffletti talk about the vaccine, and people are really getting upbeat about that. But we do have to still be careful. We still have several more months, as you're hearing, to get through this. Right now, the hospitals are still half of what they were with corona cases back in the spring. They're still half. They're about over 1,800 folks in the hospital at this point with COVID-19, with the average age of 69. So that's going up a little bit more than it was in the spring as well, where the average age was a little bit lower than that. We also have, as Dr. Potvin said, 371 in the ICU, with 200 of those that are actually on ventilators. And that percentage was up by 104% since Thanksgiving, so more than doubled. With the capacity that was discussed by Dr. Triffletti, here in the southeast area, we have, about 19% of our beds are open. And ICU beds, about 59% of the beds are open for ICU beds here in the southeastern part. And there are, again, plenty of beds open in the Commonwealth as well. There are two surge locations open. As I talked about before, the DCU Center is up and running now and has patients in it. It holds up to 200. As of the other day, they had about 50 patients there. And there's a new center opening up in Lowell as well, another surge center that'll be opening up as a field hospital. The 7-day average for confirmed cases is still running under 6. It's at 5.88. With the number of confirmed cases that Dr. Potvin mentioned, the 286,000, compared to the 9,684,933 tests that have been done so far this year, that's at 3%. As Dr. Potvin mentioned, the deaths of over 11,000. 63% of those have come from nursing homes, which is a little over 7,000 now. We've hit the 7,000 mark there. With regard to the confirmed cases over a 2-week period from November 22nd to December 5th, from those ages 0 to 39 years old, 26,000 folks were confirmed with coronavirus. Those ages 40 to 59 years old was 13,970. 60 to 69-year-olds is 4,600, and 70 plus was 3,993. So you can see those, those are the folks that are more susceptible to this. Those that are somewhat elder, that have some pre-existing conditions, and those are the people that we still need to keep in mind that we still need to protect. So wearing the mask is the best thing you can do, and stay distance, et cetera. As it was mentioned too, as the governor said, no travel over this holiday. Only have people in your immediate home for the Christmas holidays. It's probably the best course that we can do at this point. It's going to get worse before it's going to get better. So we just need to keep in mind with this. Yes, we can go ahead and start celebrating the vaccine, but let's don't celebrate too soon. One more thing I did want to bring up, Steve, with regard to the vaccine. On the DPH dashboard, starting next week, there's going to be statistics with regard to the vaccine, the numbers being given out, et cetera. So we'll be tracking that on this show starting next week. And as was mentioned by Dr. Potvin as well, for long-term care facilities that are out there, CVS and Walgreens will be providing the vaccines into the facilities. So they'll be going to the facilities to provide those vaccines. So that will begin the week of December 28th. And one last thing too. I was just watching the governor on at noontime today, and talking about the snow that's coming too. Because of the snowstorm's going to be hitting the entire Commonwealth, and due to COVID, there is less plows and less plow people that we actually have for the roads. So he is asking, and pay attention, Chris, he's asking everyone to stay home tomorrow. Don't be on the roads. And if you have to be on the roads, just know the roads aren't going to be in the best of shape as they probably usually are in a major storm. You may have one lane going down a highway, but eventually they'll catch up to get to that. So as many people that can stay home, he's asking that people do stay home. And that is the update for today, Steve.
Thank you, Plymouth State Representative Matthew Muratore. We're now going to go back through our panel. We have a few questions and also ask them each to give our closing thoughts. We're going to begin with Dr. Philip Trafletti. And Dr. Phil, the question is, how do we determine if one vaccine or another is better for us, such as allergy reports? And moving forward, where will we get information about how, when to schedule our appointments for a vaccine? And your closing thoughts.
Sure. Thank you for that question. It's way too early, I think, to say which vaccines will be safest for individual people. I know, we've made some progress over the years with what I'll call designer drugs, where it can be tailored to individual needs of people. But apart from what I did mention about the allergic reaction situation with the Pfizer vaccine, I would say it's way too early for us to know this. I do know that people who work in the vaccine industry are hopeful that they may be able to, have some discriminators about which ones are best for different individuals. As far as scheduling it, it's just too early at this point. And, even myself, being in healthcare, talking to my administrators, they're not sure, when my vaccine availability will be coming, but, I know it will come eventually. And that's pretty much the same answer I have to give to my patients and people in the community. If you're not a healthcare worker and you don't work in the nursing home industry right now, you have to wait, but these vaccines will be coming. I feel very confident. The supply is there. The distribution methods will be there, and, we'll all be getting it very soon. And the last thing, I just want to talk again, my parting message about the holiday, just, really think about, how serious this is. Think about how many people that have been infected. How many people do you know that have been hospitalized? How many people do you know that actually have died. I'm sure all of us know people that have actually died of COVID because it's been so widespread here, even in Massachusetts. So keep that in mind. It's serious. We got to do those right things. We have to stay with our immediate families. We have to wear masks at all times if we're not with immediate family members. So, continue to do that. I think that what the schools have accomplished and, what has happened in the houses of worship, as you heard here today, I mean, if you wear masks indoors, I think you're very well protected. So I think the key is, don't let your guard down. Don't take off the masks. One point I will say, if you decide to have people other than your immediate family come to your household, you really should try to insist on a quarantine of 14 days. I realize today's the 15th, that'll leave you a little short, but that's what I tell my family members if they want to come to my household, that they should quarantine themselves for 14 days before coming. And that's really the only really safe way to protect everyone. Testing provides a little bit of extra safety, but not the same as if you quarantine. So I wish everybody the best during the holidays, and please stay safe out there.
Thank you. That's Dr. Philip Trifletti. He's an attending primary care physician at Beth Israel Deaconess. And outside of his professional life, I can tell you personally, last night he called me. We were talking about possibly having contact at New Year's, and we talked about testing, we talked about masking, and we talked about quarantining. So he practices what he preaches. And at this time, we're going to go to Dr. Barry Potvin. Barry, question for you. With respect to the town of Plymouth, cities and towns across the Commonwealth are starting to roll back their phases. Is there any consideration being given to that in Plymouth? And your thoughts, final thoughts.
Well, if you look at what's going on across the state, a number of communities in and around Boston are rolling back to phase 2, which involves some more restrictions on museums and gyms, but there has been no discussion about that having to happen here in Plymouth. Certainly, if it became necessary, and we hope it wouldn't, there would be consideration given to that. But we're not currently thinking about doing anything like that, and we certainly hope we won't have to. In terms of closing thoughts, as Matt probably knows, if you're looking at this data on a daily basis, sometimes more than once, it's tough. It's tough to maintain a positive, hopeful sort of attitude when you're seeing all these dire figures coming across all the time. But I'm not really feeling somber today. I'm feeling very hopeful and upbeat. Maybe it has something to do with the snowstorm that's coming, because I will admit I'm a snow lover, always have been. And so I'm looking forward to a quiet, restful, peaceful day tomorrow. I'm sure Ken will smile when I say this, but I already have my Enya winter theme music CD ready to go. And going to try to relax. I hope everybody else will. Watch the snowfall, sip some hot chocolate or the beverage of your choice, and be hopeful, because the vaccine is here. We're going to be distributing it. The federal government seems to be finally getting its act together, I hope. And they may be under, some positive present for us for the new year in terms of putting out this financial support package that may cover vaccine distribution, some more help for small businesses, some more help for unemployment funding, and probably some more help for the people that are having trouble with housing in terms of rental support. So there's a lot of positive things to think about. I'm going to try to focus on that at least for the next day before I look at any more numbers. And please finally, have a safe but joyous holiday. And it can be joyous if you just look forward to next year and what's likely to be happening and how different things are going to be and how much better things are going to be starting in the summer and the fall of the upcoming year. So please enjoy your holidays, and thanks a lot for having me.
Thank you, Dr. Barry Potvin. He is Professor Emeritus, Yeshiva University, Department of Biology. At this time, we're going to go to Dr. Christopher Campbell. Chris, what's your takeaway today?
Thanks, Steve. So just, again, we're focused on what's best for the community, staff and students as they enter school each and every day, and trying to be very transparent while still respecting privacy. We're trying to be as communicative as possible, sharing our information through phone calls, notification letters, our website, social media platform, I encourage people to view our social media accounts for the most reliable information. Call your principal, our school health director's office, or my office. If you have any questions, we're happy to take your calls. Everyone's doing a tremendous job following the prevention strategies in school, and it's demonstrating success. And it's just equally important, as everyone said, to do this when we're out in the community. We need to social distance when we can, always wear a mask when we cannot. Families keeping their children home when they're sick. We're so appreciative of families' efforts to do the right thing, monitoring their children for symptoms, communicating with us, and testing when necessary, and notifying us of situations. The transparency has really been really important. We're going to continue to do what's best for our school community and staff and students that enter our schools each and every day. Safety is our #1 priority, but together we can do a really good job and continue to have success. So lastly, I feel the need to talk a little bit about snow days, since it's been a hot topic. The Department of Education actually allowed districts this year to use remote days in lieu of snow days. But we chose not to do that, even though a lot of schools across the Commonwealth will be attending school regardless of the weather tomorrow, even if it's a significant event, and going remote. One reason we felt it was important students have an opportunity to continue to enjoy that traditional snow day. I think we'd all agree that the last 9 months, our students have had a great loss. We've taken a lot of things away from them as a result, out of necessity. And I think it's just, personally, I think it's one thing that we have control as to whether or not we take that away from them. So let's not take away that snow day. But there are some logistical reasons too. I mean, we're concerned about connectivity. It's always, a concern of ours during a nor'easter, if we're going to be able to connect, as well as some of our vulnerable populations. We have students that, because of the nature of their disability, they can't learn remotely. They've been coming to school each and every day. And we can't replicate that remotely. So we're happy to move forward with the traditional snow day and hope that we can give students that experience tomorrow. And it's looking pretty messy, let's just say. But be patient. It's not our standard practice to cancel school the day before, but we will communicate as early as possible. So, we do understand the possibility of the snow day is very exciting. Just ask for your patience. But again, really happy, so appreciative of the community support. And and I hope everyone has a wonderful day tomorrow enjoying the snow.
Thank you,
Thanks, Steve.
Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools. We're going to go to Stephen Cole now. He is Executive Director of Plymouth Regional Economic Development Foundation. Steve, what are your closing thoughts?
Well, closing thoughts, I just want to say, now's the time of year, or it's certainly the year itself, where we're all doing something a little differently than what we were expecting to be doing. Now, it's not in our charter at the foundation to do charitable giving unless there's a national security or national emergency, which we obviously find ourselves. We typically focus on things like land use, small business development, workforce development. However, economic development, if nothing else, it is about enhancing quality of life. And I'm very proud, so proud of the board at the foundation for generously giving from our own personal endowments so that we could support families here in Plymouth. It's typically not something we do. However, if enhancing quality of life is economic development, buying someone shoes or a coat or quality of food, that's enhancing their quality of life, if even for a short time. And that is economic development. So although it's not something we typically do ourselves, I'm so proud of the people on this board, Matt Muratore, Ken Tavares, I know a friend of the program, Amy Naples. They won't be the ones to tell you that they voted in favor of this and presented it, but they did. They presented it to the board, they argued for it, and the board ratified $2,500 to come from our account to go to the Plymouth Sue Giovanetti at the Plymouth homeless shelter. So if you are in range of my voice, I want to encourage you two things today. Give generously as you can. There are people in this town who need it. Unmet need is significant this year. And second, think about that kind of job you want to have when all of this is said and done, because there are going to be resources available to help you start your business. And we are ready for it here in Plymouth. And as I mentioned earlier, we take care of our own. So if you invest in Plymouth, we're going to make sure that you are in a stable position and that we're going to return that investment to you. So thank you, Steve. I appreciate the opportunity, and I look forward to seeing you on the other side of the holidays.
Thank you, Stephen Cole. We're now going to move to State Representative Matthew Muratore. Matt, what's the takeaway today?
Well, thanks, Steve. Always a pleasure to be on with all these folks, and good to see Father John again being part of the program. Thank you so much for your inspiration. I think we just heard Chris almost announce no school tomorrow, but he didn't quite do it yet. So he's getting there, I think. But I do want to echo what Dr. Campbell had to say too about those families that are out there that are dealing with this. Feel free to contact the school nurses. They are wonderful. We have kids in the middle school and the high schools, and they were fantastic through this whole thing, as was Karen Keene. So the people are out there. We have great resources, and they're there to help you. So let's take advantage of that. I do want to let people know, if tomorrow during the snow day, if you have a chance to go on and watch Saturday Night Live this past week, they did a skit on COVID, a COVID family, and they came from this perspective of being COVID people. It was hysterical. So if you want a good laugh about COVID, I would suggest that you kind of just Google that Saturday Night Live COVID skit, and you'll get a good laugh for a few minutes. So with that said, Steve, again, controlling COVID is good for not just our health, but our economy and our schools as well. So we will see you next time on the show. And again, please continue, practice social distancing and continue to wear a mask.
Thank you, Plymouth State Representative Matthew Muratore. We're now going to go to Father John Culloty for that inspiration that State Representative Matthew Muratore just mentioned. And unmute. There we go.
How inspiring I am. But, you know, the nice thing about today's gathering, a little different than the past ones, is that there are some hopeful signs with the vaccine that so many people pointed out. So many past meetings, we're still kind of in the dark about how things would shape up. So I had tried in the past to just leave on a little bit of a more humorous note. So I was thinking today about the story about this car that goes speeding down the road right past the police cruiser. So the police officer turns on the lights and the siren, stops the car, and he's surprised to note that driving the car is a nun. And he says, "Sister, do you realize how fast you were going?" And she said, "Yes, officer, I was going 80 miles an hour. He said, "Well, sister, the speed limit here is 35. "Oh, no," she said, "I think you're wrong. I just saw the sign back there. I always observe the speed limit. And the sign back there says 80. That's why I was going 80 miles an hour." He says, "Sister, you're mistaken." He said, that's the route number. You're on Route 80. It's not the speed limit." Looks across the other nun who's sitting in the front seat, and she's shaking like a leaf. She's white as a ghost. And he says, "Sister, are you okay? Should I call an ambulance? Are you feeling all right?" And she said, "Oh, I'll be fine in a couple of minutes." She said, "Now that we're off 128. So that's, I wish I had a Christmas story for today, but I don't. But on that hopefully happy note, I wish all of you the best at this season of the year. And as I say, look forward to next year when hopefully we can have wonderful and good news for all involved. Thank you.
Thank you. And that's Father John Culloty from St. Mary's Church. We're going to end now with Kenneth Tavares, where we began. He is the chair of the Plymouth Select Board. Ken, what do you have for us?
Well, first off, thank you, Father John. I've been actually waiting for the end of the program for the joke, and you didn't disappoint us, especially when we have Route 80 in Plymouth leading to the Sacred Heart School. I just want to know who the nun was. Also, I want to pick up on something that I believe it was perhaps Matt that said it, is that we need to be patient tomorrow with the snow. We have DPW workers that are being quarantined. Our numbers aren't as large as they normally have been before for storms. We will take care of the roads. It will get done, but it's going to just take a while. So please be patient with the town forces. They're going to do the best job possible. And also, I want to end, I feel the same way, that there is hope, and it's an upbeat meeting that we've had today, but still it comes back to the same three things: mask, hands, and distance. And that's something that we have to keep emphasizing. We're getting there, but it's going to take a few more extra steps. So thank you to everyone. Be safe tomorrow. And if you're out and about Friday and Saturday, shopping in Plymouth is a great place to go. You don't have to leave town. We've got some great businesses that are open, will be open this weekend. Do your Christmas shopping. Thank you.
Thank you, and that's Kenneth Tavares. He is chair of the Plymouth Select Board. Thanks to all the members of our panel, including Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Christopher Campbell, Stephen Cole, Father John Culloty, of course, Matthew Muratore and Ken Tavares. Next week, we're going to be having a special presentation during the holiday week on Tuesday, December 22nd at 12 noon. Please join us at that time. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us. Good day.